What was your most memorable experience while you were president of the ASDS?
There were quite a few things. It was a pretty active year, but I have to say the number one thing for me was that we were able to, with other organizations, able to get SGR repeal, the Sustainable Growth Rate Formula repeal after 15 years of trying it. I went to Washington with other ASDS members and met with my congressman, Senator Blunt, and with my representative, Ann Wagner, and we were able to get that done. We were facing a 30% cut in reimbursement for physicians, and so we were able to put an end to that. That was going on for 15 years. So that was, I think, the biggest accomplishment that we had during the year. Now, on the personal note, for me, the best accomplishment really was when we have a president's dinner every year where they kind of make fun of the incoming president, and there's a group of dermatologists who put that show on. But in my year, my associate and former fellow actually decided to do a solo, sort of a roast or skit on my behalf for 20 minutes, which was absolutely hilarious. And I was just amazed that she put herself out there in front of a couple hundred people that she didn't even know, and did a great job. And we had a lot of fun. And the last thing was that at the end of my year, we have a Stegman Gala, and during the gala, unbeknownst to me, this was not organized by me, but some of the other members decided that as a great fundraiser, it would be that people should contribute. I think they were asking $1,000 per person to contribute to the Stegman Fund in honor of me, of my presidency. And we raised tens of thousands of dollars there. So that was, to me, was very heartwarming and felt really good about a great year.
What were the most pressing issues at that time that faced the society?
Well, the biggest issue facing the society during my year was the SGR repeal. That was number one, and it was really number 1, 2, and 3, and we were very successful in getting that repealed. So that came off the table, and now we can concentrate on other issues dealing with dermatology. The other area that we had a lot going on and still is going on had to do with scope of practice expansion by non-dermatologists and as well as non-physician, and truth in advertising legislation. It's another advocacy area that I was very involved in. In order to bolster those efforts, we published a quote, "Who are the pioneers?" close quote, showing that 14 out of 18 dermatologic cosmetic procedures had dermatologists do the most peer-reviewed publications, meaning we really own those 14 out of 18 procedures, which was very helpful in our advocacy efforts and our branding. We also started a branding campaign to make sure the public knows who are the people that they should see, and they should know that they're seeing a board-certified dermatologist that really is the expert taking care of their skin. And the other area, also fitting really into the scope of practice to some extent, is that the cosmetic surgery fellowships, which the ASDS started maybe a year or two before, but really expanded, and we got more than a dozen fellowship programs going during my year. And those have continued to grow, and of course, improving expertise, I think, is great for our patients.
What were the most significant innovations that were going on within the dermatologic surgery?
The most significant innovations in dermatologic surgery at the time, I found was, during my year, was the use of fractionated ablative lasers along with putting medications on top of the skin and using the holes that those lasers produce into the skin in order to treat bad scars. This was really shown by Dr. Jill Weibel very elegantly, how she could improve function on some of these war veterans coming from Afghanistan and Iraq, coming back with significant injuries, burn injuries, with significant scars on their all over. And using these techniques, she was able to improve the function, so they could actually start moving their arms, which were really contracted from all the scars, as well as the appearance of the scars. I'm not going to venture to say what was happening in dermatology, because really we're focusing on dermatologic surgery. So to me, this was the area that I found most helpful for our patients.
And in your career, do you have a most memorable patient that you can think of?
My most memorable patient was a mother of three who came to my office with a relatively large basal cell skin cancer on her nose. Now, the reason it was so large was because she was afraid that she would lose her nose, as her mother had many years before from a skin cancer. So she kept hemming and hawing, didn't come in. Finally, the family encouraged her to come in. So we took off the skin cancer with Mohs surgery, took several stages, went all the way into the nose. So indeed, a significant defect. This was early in my career, and so I rushed into my office, looked up in the textbook. At the time, we were still using textbooks. Looked at the textbook and what kind of repair, what kind can do to fix this for her. And so ultimately, I did a repair with a mucosal flap, rotation flap, then a cartilage graft from the ear, and then a paramedian forehead flap, two-stage flap to repair the skin portion of the defect. And then ultimately, after we divided the flap and trimmed everything and she was healed, to me, the best thing was that this lady, who was kind of on the larger side, gave me this huge bear hug with tears in her eyes, because not only was she rid of the cancer, but she still had her nose. And so she was very happy. And for me, certainly made me very excited about continuing to doing what I'm doing, because when you can make a difference for a patient, that's what makes it really worthwhile.
If you look back on your career, would there be anything that you would change?
Looking back at my career, is there something I could do differently? I think maybe in my personal life I had some issues, but I have to say that thinking about my career, I've been very fortunate that I happened to fall into doing dermatologic surgery, Mohs surgery, cosmetic dermatology, because even 32 years out, 32 years I've been at this, I love going to work every day, because there's so much joy in doing what I do that I just feel very lucky that I'm able to do that. And on top of it, I've been so fortunate that I've been able to some extent, share my joy and help other dermatologists and their patients by being very actively involved in organized medicine. I was fortunate to be president of 5 societies, including the ASDS, American Academy of Dermatology, and American Society for Laser Medicine and Surgery. In my opinion, also trying to keep the government out of the doctor-patient relationship.
And what advice would you give today's young dermatologic surgeons?
My advice to young dermatologic surgeons that are just starting out is always, always focus on the patient. You want to provide ethical, high-quality care to your patients. All the other stuff, all the other sort of call it bright lights and all the excitement and all the toys out there, that's great, and that's certainly fine to work with. But if you always think in terms of the patient first, then you will be very successful. And that also applies a little bit to the organized medicine, where I feel involvement is important. So I think it's really important to be involved with all your state, local medical societies, the derm societies, and of course ASDS, so that you can continue to take care of your patients. And these organizations are the guardians that keep you able to continue taking care of your patients. And so if you have an opportunity, become involved. If you get offered a opportunity to volunteer for some activity with those organizations, take advantage of them, even if it's not exactly what you were looking for, because once you do get involved and people see that you do good work, then you will get to advance and move through the ranks, as it were.
Do you have any predictions for the future of the ASDS?
My predictions, they're probably going to always be wrong. So I don't know if I have specific predictions, but I think the future of dermatology and dermatologic surgery is very bright. We are so fortunate to have the absolute best, the cream of the crop that go into dermatology, and then the cream of the crop of that group goes into dermatologic surgery. So we have the brightest minds in medicine in our area of specialty, which is demonstrated by the incredible amount of research and development of new techniques to help our patients, both in the aesthetic area as well as in the surgical medical area. I think that only is going to get bigger and better. There are more and more fellowships, both the cosmetic ones that the ASDS does, as well as the ACGME fellowships in the Mohs surgery, that really we have a bright future. The aesthetic and surgical innovations to help take care of our patients, it's every year, every month almost, there's new stuff coming out. And then ASDS, the ASDS is funding a significant amount of research through all the fundraising that we've been able to generate from our members. During my year, we actually had we're very fortunate in two of our members started this, and then many of us have joined on, is a Stegman Lifetime Sustaining Member program, where the members contribute significant funds to help support the society, as well as research programs, our cutting edge research program. First two members I'll just mention, Dr. Murad Alam and Tim Flynn. Tim Flynn was my first fellow, dermatologic surgery fellow. And so I felt that was that's an area which will help us to continue being on the cutting edge and making progress.
So what advice do you have for the ASDS leadership in serving its membership in the future?
My advice to future leaders as to what they should be doing is patient first. I've been saying that all along. It's as long as we focus on what is best for our patients, then and look at everything through that prism, what's best for the patients, by derivation that also is best for our members, we can then forge ahead and be successful. Certainly in the advocacy arena, that is a big mantra of ours, where I mentioned earlier, scope of practice, truth in advertising. We've been very active in tanning bed bans or restrictions to protect our patients. Focusing on that will make all the difference in the world, and makes it easy to then make those difficult decisions. When you have a decision to make about what should we do about this issue or that issue, just use that prism and you're going to come to the right decision.